The asbestos issue is not a thing of the past. It continues to this day.
We want to end this man-made disaster.
So let's ban asbestos.
As we go into the question and answer phase, and just one additional piece of information with regard to low-dose chest CT scan screening. It is true that most of the organizations that have recommended LDCT screening for lung cancer base risk on smoking, but there are two that I'm sure Steve knows about: the National Comprehensive Care Network and the American Association for Thoracic Surgery, and both of those have created two separate groups of eligibility criteria for people whose risk is based on smoking alone and people whose risk is based on smoking plus one other risk factor. And one of those risk factors that's specifically named in these criteria is occupational exposure to a lung carcinogen. So there are organizations that include occupational exposure to asbestos and other lung carcinogens as a criterion, and the age for eligibility decreases if there is another risk factor. Just an FYI. So I think there are a lot of interesting issues that have been raised by the speakers, very important issues to us as we go forward, and also as we understand the risk and the toll that asbestos-related disease is taking around the world. So I'd like to ask if there are any questions from the audience. I have a couple of questions, but are there questions from the audience? Yes.
I'm going to walk around with the mic, and I'll ask everyone to please introduce yourselves quickly with your name and your question for the panel. Yes, please.
Hi. I'm Yvette Oldham from England, and my husband died 2 years ago of mesothelioma. And I've done a lot of reading, and we have cures for lung cancer now because the big pharmaceutical companies are interested in profits, and this is very big worldwide. They see the mesothelioma issue as disappearing in time and are not so keen to invest in drugs to cure it. Do you think this is so, and how do you get around it?
Do you want to address your question to any one of the
No, whoever feels they want to answer.
In particular, Dr. Rossler, do you have a comment? Do you have an answer for that question?
I can answer regarding the therapy of mesothelioma. I think we will expect mesothelioma over the next decades. So even until now, there's not really a breakthrough in therapy. There's still need for research in this field because I'm very sure that mesothelioma will be prevalent for the next 20 or 30 years in the same amount what we see now in Germany, for example.
Yeah.
For lung cancer, it's different. Yeah.
I mean, AIDS has been cured nearly because of all the money thrown at it, but investment is not the same if they know they won't get the money back. They'll only invest, say, 500 million, which I saw written, if they think the profits will be good from it. So companies aren't going to be so interested.
Yeah, I mean, in general, I would agree with that. These are easy numbers for drug companies to look at and make their decisions about research and finances. I have to say that I don't think there was a lot of research on lung cancer until the last 10 years or not. So strangely, it was a very common disease, and yet in terms of the pharmaceutical approaches to chemotherapy to treating lung cancer, it was certainly, there wasn't sufficient attention to it. And there has been more recently. Lung cancer, those drugs help some people with advanced disease, usually stage 3 disease, but they don't help them all that much. Now, one correction though, there is some improvement in treatment of peritoneal mesothelioma. When it occurs in the abdomen, there is a regimen of surgery, chemotherapy, in which there is some clear improvement in how people are doing. Less so, or perhaps not so, for pleural mesothelioma.
So this seems to be a question about big pharma and corporate greed also. So David, do you have any comments?
Well, most of the advances in chemotherapeutics have come from federal research, and the pharmaceutical contribution has been in marketing and things. So I think that one issue is that there needs to be more lobbying for money for research for cancer in general, which would overlap this one. So I didn't answer the question you asked, but that's my view of the issue. It's also, I think, important to recognize that the money, there are enough people, unfortunately, who are getting this disease and dying from this disease worldwide. So it's not that small a market. It's, as you heard, a growing market now in developing countries.
Thank you. Let's move to our next question, please.
Next question.
Hi, I'm Doug Wolf. I'm an attorney working with some folks in Minnesota. This is a question for Dr. Weiss. The people I'm working with are concerned with a proposed mine that would be adjacent to the taconite deposits that you were describing. And they're also closely following the University of Minnesota health study. I understand that some of the scientists, external scientists who are on the advisory board or advisory group for that study resigned. Are you familiar with the circumstances, and will NIOSH be evaluating the draft final report that you described?
Yes, thank you for that. I didn't mention that during my talk, but the study was broken into two parts. One was a medical part run out of the university operations in Minneapolis. The other one was an exposure component that was headed up out of Duluth, and the university has a branch up in Duluth, Minnesota. And it's true that I should say, first of all, that I'm not sure that the study has been publicly released, peer-reviewed, and published yet. But it is true that more than half of the external advisory board on the exposure side of the study resigned in protest regarding quality assurance issues associated with that exposure component. That included scientists from the U.S. Geological Survey and the Centers for Disease Control. It's not clear exactly why that happened, and I believe the draft final report, unfortunately, includes their names as if they did not resign in protest. So there's more to be learned about what happened there, and I think that remains to be seen. But we need to watch that very carefully. Perhaps ADAO can help us with that.
Thank you. We'll move to our next question.
My name is Jill Kegel, and this one actually is probably for Joachim. You had mentioned the registry and everything, which I think is wonderful. What about those that, do we have anything for those that are peritoneal? My husband passed from, he was 6 years with peritoneal mesothelioma. Is there anything for the peritoneal? I know with the lungs, they have a registry, but what about that for peritoneal victims?
I think I don't understand the question. We have the register. These are for occupational exposed persons, which are not diseased.
Right, but what about those? I mean, is there anything that for those that develop it down here, there's no type of registry or anything for that type?
I think the question is peritoneal mesothelioma included in the registry and considered a, quote, accepted occupational disease if the asbestos exposure occurred in the workplace?
Okay, now I understand. First, the register is for all the persons who were exposed, and then when they find out the disease during the regular examination, this can be mesothelioma, and is also peritoneal mesothelioma is included. So all mesothelioma are included. It can be plural, can be pericardial, can be peritoneal, and even scrotal mesothelioma, because it also comes from the peritoneum. These are the 4 mesothelioma which are included in these occupational diseases, but only for the occupational.
Thank you. We're going to have to take one last question. Our keynote, Admiral Lushniak is here, so I wanted to open it up to one last quick question.
Hi, my name is Janine Reese. I'm with Washington State Department of Labor and Industries. I'm a state OSHA enforcement officer, and I've devoted 25 years to inspecting and citing asbestos contractors for illegal practices. Now, with the benefits of low-dose CT scan being apparently obvious for screening purposes, what's the next step to get OSHA to require the low-dose CT scan be integrated into the medical surveillance protocol for asbestos-exposed workers?
To give a brief answer, OSHA actually is now looking at another lung carcinogen, silica, and they've proposed a new standard for silica. And it took a number of years for them to work on. But surprisingly, they did not include low-dose CT in their silica standard. And they had hearings last week, and I presented on behalf of the steelworkers and introduced that idea, which I will continue to do. But if we can't win it with a proposed silica standard now, I don't know what's going to happen with asbestos.
Thank you. We're going to have to, yeah, we can do one more.
Dr. Weiss just say a word?
Yes.
I just wanted, is this on? I'll use this one. I just wanted to mention that just a few weeks ago in Dallas, there was a case, a federal case, and the judge required that the perpetrators, those sentenced, include medical monitoring for the victims that were exposed. And that did include the opportunity for CT scanning. If you'd like the details of that case to use as precedent, I would be glad to give those to you.
Thank you.
Dr. Oliver, thank you so much for chairing the first session. We thank all of you for your brilliant presentations.